Hello, everyone, and welcome. I am Dr. David Pascal, a chiropractor in Cary, North Carolina, and my practice is the Pascal Health Institute. And today we are going to be talking about this is part 4 of my treatment modalities for all of our patients, but more in particular, those people suffering with complex regional pain syndrome, CRPS. Those two therapies today that we are going to talk about is the RF machine, which is our radiofrequency diathermy, and the Avacen machine. Both of these actually change the temperature of your blood, and we get reflex benefits from that. So the first machine is our RF machine, radiofrequency diathermy, which is, sorry, we've got quite a lot of sun coming in on this gorgeous North Carolina sun-filled day. So it uses short waves from the electromagnetic spectrum to heat up your blood. And the way that we do that is we have a machine, you put your feet down on it. And of course, with all machines, not every modality that I have is appropriate for every patient. Many patients with CRPS cannot even be touched. So to use these two machines would not be appropriate for those patients. However, for those that can put their feet down on the ground with the RF machine, you're putting your feet down on a metal plate, and then shortwave diathermy goes through that. Now, diathermy is a physical therapy modality that's been around since at least the 1930s. And if you're old enough, maybe you've even been into a chiropractor's office or a physical therapist's office where they have these big, they kind of look like a aluminum umbrella almost, or something from an old 1930s science fiction monster movie. But they are, see, with the glare, I'm actually giving you that experience of what it's like to be hit with diathermy. I cannot escape the glare. This is hilarious. So you'll all have to bear with me. We will try to outrun the there. That's a little better. Sorry for that tangent, but diathermy has been around since the 1930s. It uses short wave to to heat up the tissues. So you put your feet down on this plate, and it very slowly starts putting short waves into the bottom of your feet, which then raise the temperature of your blood. And the reflex of that when we come in through the feet is that it triggers an inhibition of the pain fibers. So many people, they can have pain anywhere. You can have full body pain, you could have a headache, you could have foot pain or hand pain. But when you put your feet down on this plate and we run the shortwave diathermy through it, then the pain nerves through this neurologic reflex get turned off, and so you experience less pain. Great machine. We've had it in the office for a couple years. It is one of my all-time favorite machines, even though it's one of the newer ones that we have. And treatment sessions are about 20-25 minutes, like most of our modalities in the office. So that is our RF machine. The second machine is called the Avacen, and this is an FDA-approved device. It has been in the medical community for years and years and years and years, and it is specific for pain reduction. And the way the Avacen works is now we're using the palms of your hands or hand. You take one hand, you put it into like this box, and you put your palm down on a little metal plate, and there is a seal that is put around your forearm, almost like a tourniquet, but it's not tourniquet. It's not that tight, but tighter than an elastic band, like maybe if you had a rubber band around your wrist, like that. And the reason why we do that is, for the most part in the body, our arteries are separated from our veins, right? So the heart is pumping the blood, and it goes out into the body through tubes, and those tubes that are carrying the fresh blood from the heart that's been oxygenated are called the arteries. And then the blood that's already been into the cells and been kind of used, right? We've transported the oxygen to the tissues. Those tubes are the veins. So we have arteries going out from the heart, veins coming back into the heart. Well, we don't have arteries and the veins ever in connection in the body. What happens is the arteries just get smaller, smaller, smaller until they're little teeny tiny uh, tributaries, and then they just kind of dissolve off into the tissues. And then the reverse takes place, where these little tentacles are slowly getting bigger, bigger, bigger until they grow into an actual tube, and the blood vein is taking the blood back. But in the palms of our hand, we have a unique situation where the arteries and the veins are actually coming together without this diffuse network of capillaries. And it's regulated, the blood flow from the arteries and the veins are regulated through this very complex system of pressure checks. And a lot of that can be short circuited by having some type of pressure or circumferential pressure around the forearm. And that's why there's this compression with that Avacen when you put your arm into the box, so that it keeps open that connection between the artery and the vein. So then that metal plate slowly, gently warms up your blood a degree or so, and then that triggers the the signals to turn off the pain fibers, or what we call inhibition of the pain fibers. What I've noticed in clinical experience with both of these machines that I've had for a couple of years now is that the RF, usually one session, most people will notice a difference. With the Avacen, most people don't really notice a difference with one treatment, and even the company says it's most effective by having 3 20-minute sessions in a single day. So it's a little more difficult. It works better in a home setting where, quite often patients will rent an Avacen, take it back to their hotel or their home, and then be able to use that 3 times a day. We aren't set up that way. So we have a patient come in the morning, they'll do a session, they come in, early afternoon for their second session, and then at the end of the day for their third session. But they're both very interesting machines. They're both using technology that's been around for decades and decades and decades. They're safe. The only downside, of course, is if you are a patient that can't be touched, then those aren't the modalities for you. Then you have to do other things that don't require something on your body. If we have any questions at this point, I'd be glad to take those.
How can the Avacen help with CRPS?
Yes, so the question is, how can Avacen help with CRPS? Well, CRPS patients have pain, right? And the Avacen will inhibit the pain fiber. So even though the treatment is in the hand, it does trigger a whole body decrease in pain. You can read up more on the Avacen. They have their own website, AVACEN, Avacen, FDA approved device, tons of research, well known, well used in the medical community. Not so many chiropractors use it because it's more of a medical device, but it does dovetail quite nicely with the work that we do.
And the other one I think you covered, but you have to actually touch the plate. You can't hover over it.
Right. So the question is, do you actually have to touch the plate? Yes, you do. So whether we are using the shortwave diathermy and you're putting your feet down on the plate, or we are using the Avacen where your hand is touching a plate, there is actual physical contact. So again, it's not a modality for everyone, but for the ones that can do that, it is super effective. If you have any more questions, you can write them in the space below this video and we will get back to you, or you can always write something in the chat or email us or text us. We're super easy to get a hold of, and we want to support the CRPS community as best we can with information and with care. We have remote care that we can offer those people that can't get to us, and we have, of course, in-office care for those that can. Everyone's in a different place in their symptoms and on the planet, so we're trying to be able to provide more care for more people. And on that note, I also want to say thank you to all of you. Our group, which is just a year old, is now over 400 members. So thank you for telling your friends and your support group and other people that you know that have CRPS about us. Please continue to do that. I'd like to have as big of an impact in supporting the CRPS community as I can, but I need your help to do that. So I wish you all a healthy week, a brief journey into remission, and please use me, reach out, and I'll be glad to help in any way that I can.